Buoy Health Insights, Sharp Stabbing Foot Pain. Welcome to another episode of Buoy Health Insights, where we explore various health topics to keep you informed and proactive about your well-being. Today, we're diving into the causes, symptoms, and when to seek medical care for sharp, stabbing foot pain. If you're experiencing this type of pain, stay tuned as we guide you through the potential reasons and the steps you should take to address it. Now, sharp, stabbing foot pain can have numerous causes, but let's delve into some of the more common ones. Posterior tibialis tendinopathy refers to the inflammation or tearing of the posterior tibialis tendon, which supports the arch of your foot. If you're finding it difficult to stand on your toes on the affected side, your foot's arch appears collapsed, you're walking with a limp, or if the inside of your ankle is swollen and painful, you might be suffering from this condition. Though this is quite rare, it's important not to ignore these symptoms. Over-the-counter pain relievers and orthotics could offer relief, but in some cases, steroids or even surgery might be necessary. Plantar fasciitis is another condition marked by inflammation, but this time it's the band of tissue running across the bottom of your foot that becomes irritated. Particularly common amongst runners, individuals who are overweight, or those wearing poorly supportive footwear, it can lead to heel and arch pain. Thankfully, self-care measures like anti-inflammatory medications, stretching, massage, and shoe inserts alongside rest can effectively manage this condition. Suffering a sudden trauma like a twist or blow to the foot could result in a Jones fracture, a break in a bone on the outer side of your foot. This injury demands immediate attention, and until you can receive professional care, practicing the Rice method, rest, ice, compression, and elevation, will help. A doctor's visit will likely include an X-ray and the application of a cast or splint on the foot, although some Jones fractures may require surgery. Less common but potentially serious is Charcot arthropathy of the foot. If you have numbness in your feet due to a condition like diabetes, you could develop this syndrome, where the bones in the foot weaken and can fracture or dislocate with little trauma. It's characterized by swelling and warmth in the affected foot. Professional medical care is critical here, and a protective splint or walking brace may be necessary. Other causes could include frostnip of the lower limbs, which happens after exposure to the cold, or a foreign body in the foot, such as a splinter or shard of glass. It's important to note if you're experiencing consistent acute pain, numbness, inability to walk, or any signs of infection, seek medical care immediately. Other accompanying symptoms like joint pain, swelling, or changes in skin color are also important indicators that professional evaluation is needed. In closing, remember that while some foot pain can be treated at home, it's crucial not to dismiss severe or persistent symptoms. If any of the conditions we've discussed today seem to match your situation, please see your healthcare provider for proper diagnosis and treatment. Don't forget to rest your feet, wear appropriate footwear, and take proactive steps to avoid injury. Before we sign off, if you found this video helpful, please like and subscribe to our channel for more insightful health information. Until next time, stay healthy,